Okay, so I'm going to walk in, provide privacy. I've gathered my supplies. I'm going to wash my hands. Hi, my name is Lauren. I'm a CVCC nursing student. Today I'm going to be performing a head-to-toe assessment on you. It's just an assessment of your whole body, starting from your head and working all the way to your toes. I will be touching various body parts today. Is that okay?
Yes.
Can you verify your name and date of birth?
Ashley Brown, 5/15/1998.
And do you have any allergies?
No.
Okay. Patient's appearance is appropriate. Patient is dressed appropriately, and there are no profound body odors. Vital signs are normal. Blood pressure is 120/80. Respirations are 14. Heart rate is 72. Temperature is 98.6, and oxygen saturation is 99. And on a scale from 0 to 10, 0 being the least amount of pain, 10 being the worst, can you rate your pain?
0.
Okay. Can you tell me where you are?
My house.
Can you tell me what year it is?
2021.
And can you tell me who the president is?
Joe Biden.
Patient is alert and oriented ×3. Body movements are coordinated. Posture is erect. Facial expressions show no signs of pain or anxiety. Speech is good with no slurring. Mood is appropriate for the situation, and cognitive abilities are intact. Patient answered questions correctly. So throughout this assessment, I will be assessing your skin for temperature, edema, color variations, lesions, and breakdown. So first I will start at the head. I'm going to inspect and palpate. Head is round with no bumps or lesions. Hair is evenly distributed with no lice or excessive danger. Base is symmetrical. Skin is warm, dry, and intact with no lesions. Can you smile for me? Can you frown? Can you puff out your cheeks? Can you show me your teeth? Can you tightly close your eyes? And can you raise your eyebrows? Cranial nerve 7 is intact. And then I'm going to have you close your eyes and just tell me where I'm touching.
Forehead, cheek, chin.
Okay, cranial nerve 5 is intact. And then I'm going to palpate the temporal arteries. Is there any tenderness?
No.
Okay, there is no tenderness and good elasticity of the temporal arteries. Next, I'll be moving on to the eyes. Eyes are equal and round bilaterally. And then can I pull down on your eyelids? Okay. Conjunctiva is pink, moist, and intact. Eyes are also round. And then if you'll just look over my shoulder. Okay, and follow my pen light. Okay, patient's pupils are equal and round and reactive to light and accommodation and are a size 3. Then if you'll follow my pen light one more time. Okay, patient's eyes can move through all 6 phases. Next, I'll be moving on to the ears. I'll palpate the auricle, the lobial, the tragus, and the mastoid process. Everything is soft and symmetrical, appropriate size and shape with no lesions or drainage. And then I will come behind you and have you close your left ear. I'm going to whisper a 2-syllable word and you just repeat it back.
Baseball.
And you're right.
Softball.
Okay, patient's hearing is adequate bilaterally. And so next I'll move on to your nose. Nose is midline and symmetrical with no drainage. Then I'll palpate. Is there any tenderness?
No.
Okay, no tenderness. And can you close one nostril for me and breathe? Okay, then the next. Okay, patient can breathe freely through both nares. Airflow is adequate. Next, I'll be assessing the mouth. So lips are pink, moist, and symmetrical with no lesions or drooping. And then if you'll open up for me. Teeth are white with no visible decay. Gums and buccal mucosa are pink, moist, and intact with no lesions. Hard and soft palate are pink and moist. Uvula is midline and rises symmetrically. Tonsils are pink, moist, and intact with no lesions or exudate. Tongue has no discoloration, is moist, has a rough surface, and has no discoloration, moist, and has a rough surface. And so next I will assess your gag reflex. Okay, gag reflex is present, cranial nerve 10 is intact, and then I'll have you move your tongue from side to side on each side of your mouth. Okay, cranial nerves 9 and 10 are intact. Tongue strength is adequate. Next, I'll be moving to the neck. Neck is midline and erect. Skin is warm, dry, and intact with no lesions, and can you move your head from side to side, up and down? Range of motion is intact. I'll palpate the preauricular, the postauricular, the occipital, the cervical chain, the submandibular, the submental, and the supraclavicular nodes. Nodes are non-palpable and non-tender. And then I will palpate the trachea. Trachea is midline. Then I'll palpate the thyroid gland. The thyroid gland is firm and smooth and is not enlarged. If it was enlarged, I would auscultate for bruits. And then I'm going to have the patient at a 30 to 45 degree angle looking to the left. There is no jugular vein distension. And then I'm going to palpate the carotid arteries one at a time. And then I'm going to auscultate. Okay, pulses are 2 plus and equal bilaterally and are palpable. And I will also test the skin turgor of the chest, and chest has good skin turgor. Next, I'm going to be moving to the arms. I'm going to palpate. Okay, skin is warm, dry, and intact with no lesions. I'll inspect the hands and the palms. Skin is warm, dry, and intact with no lesions. I will palpate the brachial pulses, the radial pulses. They are 2 plus and equal in strength bilaterally. And then I'll have you squeeze my hands. Okay, grip strength is adequate. I will assess the cap refill. It is less than 2 seconds bilaterally. And can you shrug your shoulders for me? Okay, adequate resistance. And cranial nerve 11 is intact. And can you move your arms up for me? Side, in a circular motion, and flex. Range of motion in the upper extremities is adequate. Next, I will be moving to the chest. So there are no accessory muscles being used. Intercostal spaces are within normal boundaries. Chest rises and falls symmetrically. Respirations are even and unlabored. And then I would inspect the skin. Skin is warm, dry, and intact with no lesions. And then I would palpate all 6 spaces. Okay, and there is no tenderness or visible masses, and then I would percuss. Okay, and all percussions were resonant, and then I would auscultate. Okay, no abnormal lung sounds were heard, and lungs are equal bilaterally. Then I would move to the posterior chest. No accessory muscles are being used. Chest rises and falls symmetrically. Chest wall and scapulae are equal bilaterally. The skin of the posterior chest is warm, dry, and intact with no lesions, and I would palpate all the 8 spaces. Okay, then I would percuss. Okay, all percussions were resonant, and then I would auscultate. Okay, no abnormal lung sounds were heard. Lungs are equal bilaterally. Next, I would move to the heart. I would auscultate and listen to all the heart sounds. So first we'll start with the second intercostal space on the right, which is the aortic, the second intercostal space on the left, which is the pulmonic, the third, which is the herb, the fourth, which is the tricuspid, and then the fifth, which is the apical. No abnormal heart sounds were heard. and I would palpate the apical pulse. There is visible pulsation at the PMI, and the PMI is palpable. And next I would move down to the breast. So if you'll just put one hand on your head, I'm going to teach you a monthly breast exam. You'll do this once a month and in the shower. After your menstrual cycle, you'll start in the middle of your arm, work your way down through the armpit, making sure you're not feeling any of the lymph nodes. And then you'll move in a vertical motion over your breast tissue, making sure that you don't feel any lumps or bumps or feel any masses. Making sure that there's no discharge coming from your nipples, and always making sure that they never become inverted. If any of these things are present, then you will notify your provider. Okay, so next we're going to move to your abdomen. Okay, so first I'll note that the abdomen is not distended or any visible masses. And then I would auscultate. Start in the right lower quadrant, right upper, and left lower. Vowel sounds are present. And then I would percuss right lower, right upper, left lower. All those sounds are present. And then I would palpate right lower, right upper, left lower. And there's no tenderness or masses, distension coming from the abdomen, and the skin is warm, dry, and intact with no lesions. Then I would move on to the female genitalia. Skin is dry and intact. Labias are intact with no inflammation or redness. Pubic hair is evenly distributed, and there's no excessive discharge. Then I'll have you sit up. Okay. Can you stick your feet out for me? Can you bring them back in? And then can you flex your feet down, flex them up, go in a circle? Okay. Range of motion of the lower extremities is intact, and can you push up against my hands? Okay, resistance is good. Capillary refill is less than 2 seconds. I will palpate. The skin is warm, dry, and intact with no lesions all the way down to the ankles. And then I would palpate the temporal artery, the popliteal, the dorsal pedis, and the posterior tibial. All pulses are 2+ in strength and equal bilaterally. And then I would also assess the skin turgor. Skin turgor is good. And then I will inspect the rectum. The rectum is intact with no inflammation or lesions. And when's the last time you had a bowel movement?
This morning.
Okay. And then I'll have you stand up and walk to the table. Okay, patient's gait is normal, and then I'd have you do a tandem heel to toe. Patient's balance is smooth, and then I'll have you bend over. Okay, there is no spinal curvature, and then I'd have you sit down. And then I would wash my hands and document.